first on a daily basis and now twice a week for small businesses throughout the state. And in those briefings, we've watched the data. We've watched infection rates and hospitalization rates and death rates. We've watched positivity rates and what's happening in other states and in other countries. And we've done that because we know that data matters, and it matters because it's also what may trigger further government restrictions. So we watch what's going on. And more recently, we've watched vaccination rates, because vaccination really is one thing that people can do that will make a very positive difference for small businesses in their community. And if we are going to heal this economy and get back to a thriving economy for small businesses, we know that vaccination rates are really going to make a difference. So we would say this: we recognize and we respect that the decision to be vaccinated is a personal one. We know that people throughout our state, there are those who are still considering being vaccinated. And I would just encourage those to consider the impact on small businesses in their community and throughout our state of their decision to be vaccinated. Thank you. Back to you, Ruth Ann.
Thank you very much, Rob. And now that we have that kind of big picture perspective from Brian and Rob, we are going to put a face and a story behind that. So first, to do that, I'm pleased to introduce Dr. Geneva Tatum. She is the Associate Division Head of Pulmonary and Critical Care Medicine at Henry Ford Health System. Dr. Tatum, take it away.
Good morning, everyone. Thank you so much for inviting me here. I'd like to begin my remarks with some of the COVID numbers specific to Henry Ford Hospital in Detroit and the health system in which I work. As of 8 a.m. this morning, of the 109 patients hospitalized with COVID, 22 of them are in Henry Ford Hospital. I think what's important to recognize, while those numbers may seem low, they are still not insignificant. Because that impacts the ability to care for other patients who are not hospitalized with COVID. More importantly, of those patients who are currently hospitalized, 77% of them are unvaccinated, and about 15% of them are in between doses. These numbers further illustrate the need not only for more people to be vaccinated, but it's also important to be vigilant in reducing exposure until fully vaccinated. So it's incomplete or ineffective if you're not making sure that you prevent exposures if you've not completed a complete series of vaccinations. We know that vaccination is extraordinarily safe and highly effective for preventing serious illness, but also for preventing hospitalization and progression to life-threatening disease. When these vaccines were studied, we know that they are 94 to 95% effective in preventing moderate and severe COVID-19 related disease. I personally have been through 3 surges of COVID patients with my teams working in the medical intensive care unit at Henry Ford Hospital, and we are all deeply concerned that we're going to have a 4th surge. We've seen the devastating effects that this virus has taken on the human body, including those who were otherwise healthy when they came into the hospital and thought that they didn't have to worry about being affected or infected by COVID, and thought that even if they did get infected, they'd have a relatively brief or low symptom course. But even those patients, we've seen devastating consequences of COVID-19 disease, and all too often, too many patients that did not survive. I've spoken with many unvaccinated patients who remain convinced, even after 18 months of this pandemic, that they were healthy enough to beat this virus. And too many people, unfortunately, continue to rely on misinformation and disinformation that we've seen has drastic and deadly consequences. As mentioned in some of the other comments, I've also seen many patients defer care for other medical conditions, such as COPD, which I see in clinic, heart disease, or even lung cancer. And unfortunately, the more COVID-19 cases that we have, the longer these patients will postpone care, which again can have devastating impact on their health. When they finally do come to get care, they are sicker, their disease is more advanced, and in some cases, which I've seen, too severe to cure at that point. And as a pulmonologist and critical care medicine physician, I'm heartbroken and devastated by seeing our communities suffer by such a high burden of disease. And I'm also heartbroken and discouraged by patients who continue to remain unvaccinated because they thought they could outrun the disease. What we know is vaccination is effective, and we know that we can prevent an enormous number of hospitalizations by vaccinating our citizens here in the state of Michigan. It's, you know, our COVID vaccines are the most effective tools that we've had. 1 year ago, these tools were not available to us. And so our only way to avoid this was literally by staying away from each other and wearing masks and staying inside. Now we have more effective tools that we can use as adjuncts to social distancing and mask wearing in public to help us stay healthy and prevent people from being hospitalized. Our intensive care unit team is top-notch, highly experienced, and focused on delivering high-quality care. And we're highly accomplished at treating the most critically ill. Our medical ICU is one of the busiest in Michigan, irrespective of a pandemic. So we're skilled at caring for large volumes of patients. But I can tell you, after 3 surges and a potential 4th one, our teams are very concerned. Staffing shortages that are happening all around the state have us strained as well. And we are losing our sense of hope that we would be able to end this pandemic faster when we started our vaccination rollout many, many months ago. We've not seen our medical ICUs return back to their normal pattern and volume of patients yet. And so we're concerned that we've still not made it to the other side of this pandemic. We want to make sure that we remain hopeful and not be discouraged by what we're seeing with low vaccination rates. I think one other element is that my early career doctors and those doctors in trainings are really challenged by these surges. You know, for those who are younger in their career, they're seeing many patients that are actually their same age. And they struggle in making inroads in helping those younger patients recognize that they are at risk and 2, may get severely ill enough to wind up needing critical care help. They recognize how patients' beliefs impact treatment plans and how they follow recommendations. And it's challenging for them to help them understand and help their patients, more importantly, understand what science is teaching them and help them talk to them in a constructive way. I think it, you know, in summary, it's incredibly important to make sure we get more patients vaccinated, because if we don't, the threat of a 4th surge is very real. The strain that we are all under, we are all very concerned, may be a tipping point for all of our health systems around the state. And this scenario is even more concerning now that we know our typical flu season is fast approaching. Hospital capacity and resources may not be able to meet the demand and due to the threat of sort of these 2 confluent diseases happening at the same time. And this is happening all across the state, and that's what we're very concerned about. We don't want that to happen. We all know that the stakes are too high for that. And we can end this pandemic once and for all through vaccination, because we all want to get back to a sense of normalcy, a sense of our normal lives and our lives connected and in community with one another. So in closing, you know, certainly I can say with the utmost confidence that vaccines are safe and they work. I personally was one of the first of our frontline healthcare workers to be vaccinated, because I knew the importance of not only protecting myself and my family, but also protecting patients that I would be caring for within the health system, and protecting the community was very important to me. I know that a decision to get vaccinated should be a medical decision and nothing more. I've seen far too many lives changed forever and far too many patients lost during this pandemic. And for those who remain unvaccinated, we're concerned that time may not be on your side. The vaccine is the single best tool that we all have to emerge from this pandemic with good health and an encouraging future. And with that, I'll send it back to Ms. Sutter.
Thank you, Dr. Tatum. Very powerful words there. And next, we're going to hear from Bill Kimball, the president of C2AE and the chair of the SBAM Board of Directors. Bill?
Great. Good morning. I appreciate the time. Our office, we have 5 offices in the state of Michigan, so we cover everything from the Upper Peninsula all the way down to the southern part of the state. We also have 2 offices in New York State. So when I give the perspective of the impact to our company, as well as the clients that we work with, we provide architecture and engineering consulting services to government, education, and manufacturing clients across those regions. One of the major items for us and impact was on our employees. And as Rob already mentioned, when you don't know whether your children are going to be in school or not, whether you're going to have to be home with them to make sure that they're, doing what they need to do remotely, that's a big challenge. That adds a lot of stress to our employees' life. So what we've seen over the last 18 months is that stress level go up and a productivity level go down. And so one of the direct impacts on most businesses that have made it through the pandemic, and we're planning on making it through, by the way, we're not planning on closing our doors, but one of the major challenges is that productivity decrease. In the architecture and engineering world, we rely heavily on collaboration between members. If you can think about a project, an architect has to speak to a mechanical, electrical, and structural engineer to get a project done efficiently and effectively. And so one of those major impacts on us is just being together in the same space, being safe. And so we've, from the beginning, highly encouraged our staff to get vaccinated. We have not required it, and we are not asking whether they're vaccinated, but we continue to stress the proven fact that vaccines work, and it's our best defense, as others have said, against this pandemic. And for other outside looking to our clients, since we're in the government market and the manufacturing market and education market, those clients are putting a tremendous amount of energy into fighting the pandemic and the continuing fighting of the pandemic. And what that's doing is taking away resources that they can put toward projects. So our projects are being pushed off into the future, and our project load has been decreasing, despite the fact that there's some stimulus money coming out and additional projects coming out. That's having an overall impact on our business. And so again, our message is for small business, get vaccinated so that we can operate efficiently and effectively and keep productivity where it needs to be. And our clients can then take their resources, their valuable resources, and put them toward projects to advance their businesses in the future. And so, again, I'll keep it short, but we are encouraging those who are not vaccinated to seriously consider getting vaccinated. We realize there's some health conditions out there that prevent some folks, but that's a few minor individuals in the grand scheme. Most of the staff here at C2AE are vaccinated, and we certainly appreciate that. So with that, I'll turn it back to you, Ruth Ann.
Thank you, Bill. We appreciate you lending your voice to this conversation today. And last, but certainly not least, Dr. Nicole Linder, Chief Hospitalist from OSF St. Francis Hospital Medical Group up in my hometown of Escanaba. Nicole, go ahead. You're still muted.
So thanks for allowing me to represent OSF and other small rural hospitals throughout Michigan today. As she said, I'm the chief hospitalist at OSF St. Francis. We're a 25-bed critical access hospital. We have a 4-physician and 1 PA group. So we're a small, tight-knit group. And we really don't have any other medical specialties on site, and we don't have an ICU. We do have general surgery. That's about all we got. So we actually have cared for an inordinately large number of COVID patients during the pandemic for the size of the population of our area. And we've struggled at times with bed capacity, and our facility was able to get emergency authorization to increase the number of our beds available. But those beds, were expanded, but we did not have expanded staffing. So, for that increase in volume, the entire hospital staff kind of drew together and worked extra shifts and stayed late and did all we could to help out each other and our patients. And I'm very proud of the work that we all did and our care team and the care we've provided to our patients. During times of very high COVID volume, there were no beds available in our regional ICUs that we would usually transfer our most sick patients to. This includes COVID patients and a lot of non-COVID patients. And, we used a lot of virtual webinars and other modalities of learning to stay abreast of all of the emerging treatments. And we utilized telephone consultation with specialists such as pulmonology, infectious disease, and critical care medicine at our regional ICUs when there really was nowhere and no ability to transfer these very sick people. And during and after this crisis, we did lose a significant number of nursing staff, and unfortunately it tends to be the older, more experienced nurses that you tend to lose, and we've lost some to early retirement, and some just decided to move to different areas of nursing after going through everything they did. And I know this is happening all over the United States. We're not unique. I was really relieved and really hopeful when there was a highly effective vaccine developed much more rapidly than I could have dreamed. I think there was a feeling that we were getting to the finish line and we just had to hold on until the vaccine was available and then everyone would be vaccinated and this whole thing would be over. And unfortunately, we now know that's not the case. And we're currently at our hospital experiencing a significant wave of COVID right now. We're seeing many of the same systemic problems again. Can't get our patients transferred out to critical care services, and non-COVID patients that need a bronchoscopy are not getting where they need to go, not getting transferred for some of the cardiology things they would normally be transferred for. So it's causing a lot of difficulty for all patients. And there are some new challenges in caring for this wave of patients that we didn't really have to deal with the first go round. The difference is that nearly all of the patients we're caring for made the choice to not be vaccinated. And we've seen very few vaccinated patients in the hospital, less than I can count on one hand. None of them have been very critically ill. None of them have died of the disease during our time with them. And the patients that we're caring for, and usually their family members that we do deal closely with during their stay, a lot of them have a distrust of medicine in general, and that's part of why they were not vaccinated. There seems to be a sort of disbelief when they are very ill and coming to the hospital that they could really be this sick from COVID. But at the same time, they really, want and expect, the highest level of care be provided. And there seems to be this erroneous belief that, all these patients should be at a tertiary care center, and that if we just gave the right cocktail of substances to them that we can cure this. And unfortunately, we all know that's not the case. The one thing really has struck me is most of the patients that give me a reason of why they're not vaccinated, it's because they don't want to inject some untested or foreign substance into their body. And I don't think that people realize that if they do become ill enough to be hospitalized, they're going to be injected with a lot of foreign substances, and most of them are less proven than the COVID vaccine. Remdesivir, monoclonal antibody therapies, steroids, all these are very strong immunosuppressants, anticoagulants to try to prevent some of the thrombotic complications that we see with COVID. And, this is all to avoid getting a vaccine that has been proven to be safe and effective. And if you get the vaccine, you have a 0.001% chance of dying of a breakthrough infection. That's a staggeringly small number. And that is highly, highly effective. And I think people overestimate the effectiveness of the treatments that we have for COVID in comparison to the vaccine. The best treatment that we have so far that I'm aware of is dexamethasone, and that only decreases your risk of death by 20 to 30% if you have a moderate to severe disease, but you can't even give it in mild disease or it increases your risk of death. So we truly need to get the message across that our best treatment for COVID is to never get it in the first place. So there really aren't any miracle cures, despite what some of the media and public figures have led the public to believe. And in closing, with her permission, I do want to tell you a personal story about a patient, a very special patient I actually had to hug and say goodbye to yesterday because I was going off service. Her name is Kathy, and I've cared for her for the last 3 weeks. And she had refused the vaccine adamantly, you know, and she contracted COVID, came into the hospital. Her husband had received the vaccine and did get a mild breakthrough infection and was fine. She was not. And the first day that I met her, the day after she was admitted, immediately she told me, I really regret now that I didn't get that vaccine. And during her hospital stay, she campaigned, she was on the phone, she was calling all of her friends and family that, like her, had refused to be vaccinated. And she was able to get at least 6 so far of her family members and friends to get vaccinated, but it was too late for her. And despite everything that could possibly be done for her, she's going to lose her battle and lose her life. And she's vivacious and gregarious and just a wonderful person. And this did not have to happen. And her family didn't have to lose her. So I am fatigued and I am heartsick and I'm tired of watching people suffer needlessly and die of a disease that could have been prevented by a simple and safe and effective vaccine. I don't want to watch my patient's family suffer with the grief of this and also the guilt if they played some role in their family member's decision not to be vaccinated. You know, the issues that we're dealing with and caring for these hospitalized COVID patients that weren't present during the earlier waves, I think do create a new dimension of stress and sadness and fatigue for those of us on the front lines. You're taking care of people that are dying that didn't need to die. And our hospitals, you know, we're part of a very small community. These people are our friends, they're our family members, you know, the people we see at church, and we don't want to see any more of them suffer. And, you know, we have pandemic fatigue too, and we want to go back to normal, and we want to go to movies and restaurants and concerts and sporting events and weddings and funerals and church and school without the fear of infection. The only way we get to that normal is by all of us being vaccinated to protect ourselves and each other. That's it. Thanks.
Thank you very much, Dr. Linder. We appreciate you sharing that story, which is very powerful. All right, with that, I want to open it up to questions for our speakers from the media. Please keep your questions to the topics we've discussed today. If you do have a question, please indicate so in the chat or raise your hand, and then we will call on you before you unmute yourself to make sure we keep things in order. So any questions in the chat or hands raised, Lucy or John? Let's see. It looks like Justin Hicks from MLive is the first. Justin, go ahead.
Thank you. So the message here today seems to be that, you know, getting vaccinated is important. And while we do have some hospital systems in Michigan that are mandating the vaccine for their employees, we do still have some health systems that are not requiring it for their employees at this time. Should all health systems require their workers to be vaccinated? And does allowing employees at hospitals to not be vaccinated put patients in danger?
Thank you for your question, Justin. Brian, I'm going to let you speak to our position on mandates.
Yeah, Justin, it's a great question and certainly one that's been top of mind for us for some time now. And as you said, we do have a number of our large health systems across the state that have implemented a mandate with some different parameters around that, and a number that have not. And I would tell you that there's no question that everyone in our membership is unified around the safety and efficacy of the vaccine, but some have rolled out their protocol in a different way. In other words, some have mandated at this point. Others we know are considering a mandate in the weeks and months ahead. Others are very concerned about what that would mean for staffing levels, which are critical They know that they have an uphill battle right now, and it's part of why we're here today to convince their own employees that this is the right thing to do. And in many instances, as we found, it's not necessarily the hospital employee themselves that are reluctant to get the vaccine. It's someone in their household. Mainly, it's a spouse or a significant other that has concerns for one reason or another. We've heard that time and again. And so I think our members are being thoughtful about this, understanding that every community, every organization is a bit different in how they proceed. But as I said, the one thing we're unified on is the safety and efficacy of the vaccine.
Thank you very much, Brian. Next question is coming from Mark Sanchez. Mark's question is, it says that the state's dashboard shows that about 1/3 of Michigan's population 16 and over remains unvaccinated. How do we convince people who are unvaccinated to get the vaccine? Mark, that is the million-dollar question, and it is why we are here today. We are using every tool at our disposal, from showing the data behind the safety and the efficacy of the vaccine to telling stories and personal anecdotes about how effective it is and the lives lost that could have been saved by this vaccine, like we've heard from our physicians here today. And we've seen the state adopt incentives, which I think has helped to some degree to motivate people to get the vaccine. What we want to make sure is that people are getting their information from a trusted and legitimate source. And we want them to talk to their physician or their healthcare provider, whoever that might be, to get factual information about the vaccine if they have questions, and to make sure that they're not getting that misinformation or disinformation from social media or from anywhere else, but get that information from a trusted healthcare provider. So that's what we're really encouraging folks to do. And then the second part of your question, Mark, about how everyone views employer vaccine mandates. I think we heard from the Small Business Association, and I don't want to speak for them, but they are, largely not mandating the vaccine or asking for that information from their employees, but encouraging it to make sure that they can remain operational and efficient and not lose productivity. And from the healthcare perspective, Brian just responded about, again, our members all making that decision at the local level. The MHA has not endorsed nor has an official position on mandating vaccination for employees. And every employer that chooses to mandate it is legally permitted to do so. And they are going to use different tools at their disposal, whether it's incentivizing that or adjusting healthcare benefit rates for those employees, whatever it might be. That's going to be a decision at the local level. The next question comes from Lena Stebbins at Michigan Advance, and then I know that Craig Mauger will be up after that. So Lena, go ahead.
Hi, I have a question specifically for SBAM officials. Does there need to be more leadership from legislative leaders on urging people to get vaccinated? And what do you think about Senate Majority Leader Shirkey's repeated anti-vaccine comments? Thank you.
So, it's our belief that the vaccine is safe and effective. We too have been watching the data and the science, and our messaging has been clear that we believe it is safe and effective, and that employers ought to be encouraging their employees and using incentives to encourage their employees. We also have tried to understand the reluctance. And while I think I understand that there are those who just simply can't get past the idea of something that they perceive to be untested or at least new in the marketplace, we are clear that we think the science is, the efficacy of the vaccination is clear. So I would say to all of legislative leaders, lead. This is a time for leaders to lead, and the idea of vaccinations is really important for us to get back to normal, back to our economy running strong again. And while some people may still choose to be unvaccinated, we are encouraging everybody who is still thinking about it to consider the impact on small businesses in their community and consider the impact of the economy of their decision to be unvaccinated.
Thank you, Rob. Next up, Craig Mauger from Detroit News.
Thanks for taking my question. I'm curious for Brian. You made the comment that hospitals across the state are operating at near capacity levels. Can you expand on what you're seeing from these hospitals? Because I mean, we're hearing a lot of mixed messages from state officials, different groups about what's happening with the virus in the state right now. Can you talk about what's happening on the ground in hospitals at the current trajectory that we're on with COVID hospitalizations? When are we really going to be seeing problems if this continues? If you can provide some information on that, thank you.
Absolutely. So to put this in context, during the absolute peak of the pandemic to this point, we had over 4,000 Michiganders who were hospitalized throughout the state with COVID-19. As I mentioned, we currently have a little over 1,400. That number is slowly climbing. We hope it doesn't dramatically increase because of some of the factors we discussed, but that's just to put it in some context. Now, what we've learned is that the roadblock here to being able to provide service and have the capacity to care for people that come to the hospital is not necessarily the availability of a physical bed. And I know a lot of people focused on how many hospital beds are there and how many have patients in them. The issue is staffing. You could have all the beds in the world, but if you don't have an adequate number of nurses, physicians, other healthcare providers to staff those beds, that's where we run into a problem. And what's different now, as opposed to at the start of the pandemic, is that we have lost a number of healthcare employees. Many have chosen early retirement. The pandemic has forced them to make that difficult decision. We know that many have left the hospital or healthcare setting altogether to seek employment in another setting for a variety of reasons. And so we know that right now our staffing is stressed to a level that we have not seen previously. So that's really the concern that we have right now. And as I mentioned, this is really a two-factor issue. It's people who are coming to the hospital with COVID and are hospitalized with COVID-19, but it's also this pent-up demand. The people who should have come into a healthcare setting, not necessarily a hospital, maybe it's a physician office or an outpatient facility, at a much earlier point to address a healthcare issue. And instead, they delayed seeking treatment. They were concerned about coming into a healthcare setting because of the pandemic. And now they have a very serious situation that demands more care. They have higher acuity levels. And so that's the reality on the ground right now. We are very concerned about that getting worse. And the way to prevent that, one of the ways to prevent that is getting vaccinated. There's just no question.